Hello and welcome to Plugged In. It's PKD with Dr. B, as nephrologist Dr. Mike Bevilacqua is in the hot seat answering questions from PKD patients across BC. The Canadian Transplant Games are right around the corner, and today we catch up with two transplant athletes in training. Kidney transplant recipient Brenda Brown takes a break from training for her Transplant Games debut to talk to us courtside and share her journey with kidney disease and transplantation. And get ready to meet 7-year-old sensation Addison MacArthur, a heart transplant recipient and a veteran competitor of 2 World Transplant Games as she trains for her upcoming competitions. The action is right here, next on Plugged In. Did you know that the Canadian Transplant Games are being hosted in Vancouver this year? They're out at UBC from July 2nd to the 7th. So right now, all across the country, Canadian transplant athletes are gearing up and they are training for a week of competition that is a do not miss if you're in this area. Well, today we catch up with one of the youngest Canadian athletes. She's a heart transplant recipient. Her name is Addison MacArthur, and believe it or not, at age 7, she is already a veteran competitor. She's been on Team Canada. She's competed at the World Transplant Games and brought home a gold, silver, and a bronze. And today, our Kidney Kids reporter, Sophie, meets with Addison as she has a day of training on the track for track and field events that are coming up. Great chance to meet Addison, so you don't want to miss it. Stay with us right here on Plugged In.
Hi, I'm Sophie for Kidney Kids. Today I will be meeting Addison, who's competing at the Canadian Transplant Games. Hi, Addison.
Hi, Sophie.
How old are you?
I'm 7.
Have you competed before?
Yes.
Where have you competed?
I've competed in Malaga and Argentina.
Did you have fun?
Yes.
Did you win any medals?
Yes.
Can you show me them?
Okay. This one is bronze for my long jump. And then this one is gold for my ball throw. And this one is silver for my running. And this one is gold from Argentina.
Another gold?
Yep.
So we're back for a brand new segment that I think you are really going to enjoy. It's called PKD with Dr. B, and we are answering some of the questions that British Columbians had specifically about polycystic kidney disease. So welcome, Dr. Bevilacqua.
Great, thanks for having me. I'm excited to hear what questions people have.
So our first question is from Jean in Quesnel. Jean says, I have pain in my back and headaches. Does this mean that I have polycystic kidney disease?
Okay, great, thanks Jean, that's a good question. So although we talked about earlier that some of the symptoms of polycystic disease include things like pain in that abdomen or the sides or the back as those kidneys get bigger, although that's something that can happen to people with polycystic disease, not everybody who gets pain in their back or their sides has polycystic kidney disease. And in fact, I would say the vast majority of people who have pain in their back do not have polycystic kidney disease because there's so many other reasons that can happen. So just that wouldn't be a reason that someone has to be tested for PKD or anything like that. We really do make the decision to do testing of that nature on an individual basis.
So, Addison, how many sports are you competing for?
4.
What are they?
Long jump, ball throw, running, and swimming.
Can you show me some?
Sure.
Wow, Addison, that was great. Can you show me how to do that?
So you stand apart.
Like this?
Yes. And then you throw your arm back like this. And then it's about, that's good. And then you swing your arm forward.
Boy, was that fun seeing Addison today. I can't wait to cheer her on at the games. I'm Sophie from Plugged In.
Next, we have Eileen in Vancouver. And Eileen's question is, my mother has polycystic kidney disease. I am 23 with no symptoms and have not been tested yet. What are the chances that I will get polycystic kidney disease?
Okay, so Eileen, this is a question I get a lot, and I'm glad that you asked it. So the inheritance of polycystic disease, if we're talking about the AD, PKD form here, which I'll assume we are if you're 20 and not having symptoms, that's a 50-50 chance that a parent will pass it on to their children. And for every child, it's 50-50 once over again, essentially flipping a coin every single time. So I'd say knowing that background, the chance is 50%. Even if you are feeling completely well and haven't had any problems from it, it is still possible that it's there because symptoms sometimes don't show up until later in life. So what we suggest to people is, in general, is that as people kind of make it into adulthood, this is a time that people are deciding whether or not they want to get screened. And again, this is a very personal thing that you should be talking about with your individual doctor, and there are ways of doing the test to see if you are affected. One thing I'll specifically mention here is, because I get this question a lot, is people are sometimes worried about being tested because it might have implications to do with life insurance or things like that. And what I really tell people is, I think either way, you're better off knowing than not knowing, because there are things that we look into even earlier in life. And as far as insurance goes, even if you knew that one of your parents had the condition, already you would have to tell the insurance people that, so it doesn't really change anything there. So I think that's not a reason to go looking for information.
Okay, so joining me now is Elaine Young. Hello, Elaine.
Hi, Barb.
You're Addison's mom.
I am.
You should be a very proud mom because we're just profiling Addison on the show today. 7 years old, and she's competing at the Canadian Transplant Games for the first time.
That's right. This is her first Canadian Transplant Games, but as she's told you,
right? It's a big but.
She's a veteran.
That's what I call her, a veteran of the World Transplant Games.
That's right.
Two to her name,
Exactly,
right?
exactly.
Wow. And that was, she said, what, Malaga, Spain, and
Mar del Plata, Argentina.
Wow.
Yeah.
And the family goes with.
That's right, and the grandparents come too. My parents have gone, and they're planning to go the next time, so she's got a pretty good round of supporters with her.
Wow. So at the ripe old age of 4, was it?
That's right. That was her debut at the World Transplant Games. She was actually the youngest competitor then, and the youngest competitor in Spain last year. So,
and she was on the Canadian team for this, right?
That's
so
right.
She was representing Canada.
That's right. She
was she the youngest on the Canadian team as well?
Yeah, she was for sure.
So at the age of 4, she's competing in the Transplant Games because Addison is a heart transplant recipient.
That's right. She got her heart transplant when she was just over 3 weeks old. She actually wasn't diagnosed until she was just under 3 weeks old. I mean, it's a pretty crazy story. Like, I think so many of these transplant stories are. We didn't know she was sick, and when she was 3 weeks old, she just started acting weird. I mean, I don't even know how else to say it. She was our first child, so Erin and I were kind of like, oh, something going on. She's crying. She seems really just not normal. Her temperature was really low, so we ended up taking her to the hospital, and at first they thought it was an infection. Then eventually, when we got to the Children's Hospital ICU, they started actually very quickly realizing there was something really serious wrong. And it was when they took out the echo, the ultrasound of the heart, that machine, the echocardiogram, and then it was, we're standing there watching them, and they started doing the scan, and all of a sudden you could just feel the tension in the room and the look on the technician's face, and with the cardiologist and the medical team, it was just like, oh my gosh, we have to get her into the ICU. She was in the ED, sorry, into the ICU right now. And they just, wheeled her away, and they just told us to wait in the waiting room. And we were just terrified. We had no idea what was happening. From there, you know, eventually the cardiologist came out to talk to us and said that her heart was failing, and that it was so bad at that point that they had to put her on a heart and lung machine just to keep her alive, because her heart was so sick that she wasn't going to survive without some kind of assistance. And you know, from there, that was Monday night.
At 3 weeks old.
At 3 weeks old. So that's how it started. And they spent the next couple of days trying to figure out if there was something that they could fix with her heart, or if it was something that they couldn't fix. So unfortunately, they had determined that this was not a problem they could fix, because a lot of kids are born with congenital heart defects.
I was going to ask you, is this, now that you've learned so much in such a short time at that point, at 3 weeks, is it common?
The kind of defect she has is unusual. It's a pretty rare one, but the heart defects in general, it's 1 in 100. It's the most common birth defect. Yeah, so it's there are a lot of things they can fix through surgery, at least to buy you more time, but in this case they said no, there was nothing they could do, and that the only option at that point was a heart transplant.
Bruce in Victoria. I'm a 38-year-old male with polycystic kidney disease, no symptoms yet, but I'm wondering, if I get a kidney transplant, will I still have polycystic kidney disease?
Okay, Bruce, this is another question that I get very often. So the answer is actually yes and no, and I'll elaborate on that. So the no part is that people often ask me, after I get a transplant, is polycystic disease going to affect the new kidney? And the answer to that is no. Being a genetic disease, it has to do with the genes within that kidney. So the new kidney, which comes from somebody else who's not affected by the disease, will not develop cysts or get PKD. So that part is no. Why I still say yes is that earlier on we mentioned that there is more to polycystic disease than just what happens in the kidneys. There are other organs that can be involved and things like that, and that would still be the case after a transplant, because those organs are still left untouched.
Hi, I'm Brenda Brown. I'm the Games Manager for the Canadian Transplant Games that are taking place in Vancouver out at UBC this summer, and I'm also a kidney transplant recipient. I'm competing for the very first time in tennis, and I brought along with me today my tennis coach.
Okay. Hey Brenda, good seeing you again.
Nice to see you too.
Yeah. I'm Charles Tatoe. I'm a tennis pro of Performance Tennis Academy. I run my programs out of Great West Fitness and Tennis Club here in Abbotsford, and I have got Brenda here. So, Brenda, how many weeks till the games?
I'm competing on July 3rd.
Oh, July 3rd, okay. So we don't got a lot of time, but we have to get at that then, eh?
Yes, we do, because I got to get ready.
Okay, let's get at it. So you can see you on the baseline and they start rallying.
Okay, great,
okay, very good. All right, so here we go. So nice setup, low to high, brush up. Okay, on your toes a little bit. Make sure you split step as soon as they hit the ball. Good, and brush up. On your toes. Okay, split step, good. Low to high. Excellent, good. On your toes again, next ball. Good. Again, keep your racket head up, brush up. Just keep going what you were doing. Yes, that's it. Okay, don't overthink it. That's good. You don't have to change it. That's good. Keep doing that. Okay, let's try a few backhands, okay?
Okay.
All right, good. So same thing, so you want to take your racket back, keep your racket head slightly up. Make sure you're turning, you've got to be parallel with the feet, right? Sideways with the one hand backhand. Then drop your racket head slightly. Remember, it's not a high to low. So you're going to lower your racket a little bit in the back. So
And then
yeah,
a windshield wiper.
yeah, so make sure when you're taking your racket back, in the back you're dropping your racket head slightly, yes, and then coming up. And don't hit from high to low. Unless you want to slice, but we're doing topspin now, so you want to get a low to high. Okay, here we go. Okay. Excellent, keep going. Brush up, brush up, brush up.
Victor in Smithers, and Victor's question is polycystic kidney disease contagious?
So Victor, thanks for asking that. And again, something that I've heard about from families that I treat and things like that, and absolutely not. It's just a gene that happens to be abnormal and leads to more cysts being developed. Somebody having this gene is nothing contagious. It's nothing they did do or didn't do or something they should have done differently or anything like that. It's just something that comes out in the genetic lottery that certain individuals have. But it is definitely not contagious by any means.
Hi,
Hi everyone, I've got Brenda Brown with me here courtside. Hi Brenda.
Hi.
So Brenda was just on the court training with your coach Charles, right?
Yes.
Because not only is Brenda the manager of the Canadian Transplant Games, right, this year, big job, she's also a competitor, and she's going to be competing in a couple of sports, and one of them is singles tennis. So thanks for taking a break from the training. Really appreciate that, Brenda.
I needed a rest anyways.
Give me a breather. And you're a kidney transplant recipient.
I am.
Wow, and how many years?
It'll be my 5th anniversary a week after the games.
Oh, wow, so lots to be celebrating the games. They're July 2nd to the 7th, is that right?
Correct.
Can you take us back and talk to us about your history with kidney disease and how that led to kidney transplant?
Yeah, I came on kind of suddenly. I didn't really know I had kidney disease for a long time. I had symptoms well in my 20s apparently, but they kept associating it with my pregnancies. And it wasn't until it was my early 40s when the symptoms led them to do some further discovery. I was diagnosed with IgA nephropathy, or Berger's disease. And so my kidney decline went really quickly. So I ended up on dialysis. But I was fortunate because my daughter, as soon as she found out that my kidney was failing in the early part of 2012, wanted to get on the list and get tested right away. So we started the process really early, and but even though she wasn't a match, we also then started getting involved in the paired exchange program.
So that is really, really interesting. So first of all, how old was your daughter when she started the testing?
She would have been 22.
She wasn't a match for you, so you mentioned the paired exchange program. Can you just tell our viewers a little bit about what the paired exchange program is?
It basically is a registry where you can go out across Canada to find other like matches or paired people, kidney patients and people that want to donate that aren't matches. And an algorithm basically finds other pairs that are matches across the country that will find a chain, more or less. And our chain was 3 pairs in the country that matched us up.
So it's really amazing. So your daughter wasn't a match for you, but that didn't mean she wasn't a match for somebody else.
Correct.
So she was matched with somebody else to somebody, and in your case there were 3 people, and then that 3rd person was a match for...
Yeah, so she ended up donating to a complete stranger so that I could get a kidney.
When did that happen? When did the transplant take place?
July 2013, July 17, 2013.
Wow. Post-transplant, how have you been and how has it gone?
Yeah, initially post-transplant wasn't very easy. I ended up with an infection, but within about 6 months after that, life got back to normal. I was playing baseball again with my kids. I'm on 2 slow pitch teams, 1 ladies team with my daughter and a mixed team with my son. I do yoga 3 days a week. I play tennis. It's gone back to normal. I paddleboard. The biggest thing I missed was going into the water and being able to swim because of all the attachments to the hemodialysis stuff.
Sandeep in Delta. Sandeep's question. My husband has polycystic kidney disease and I'm always worried about his diet. I know he should minimize his salt intake, but is there anything else he should do?
Great, thanks Sandeep. So as far as diet goes, you're right about the salt. I always tell people that if I'm going to give them 3 dietary tips, number 1, 2, and 3 are to cut the salt out. So by far, with any type of kidney disease, and we actually know specifically with polycystic disease, that lowering the salt in your diet is very beneficial. The other thing that goes along with salt that we often talk about at the same time is water. So although we tell people to cut back on their salt intake, we often tell them to drink lots of fluid. There's been some debate out there in the medical literature as to how much of effect that has in slowing down something like PKD, but what we can tell people is that you don't want to be dehydrated. As I say, get in the habit of having a water bottle with you wherever you go and just drink away through the course of the day. Other than that, really it's good, healthy lifestyle and dietary tips. So a good, well-balanced diet, that anybody else should be looking into is really what I recommend to my people. Sometimes when the kidney function goes quite low, we talk about very specific dietary measures that people take, but earlier on, it really is just a well-balanced, healthy diet.
such an inspiration because you are so active post-transplant, and some people do fear that, after surgery, can I actually get back to a normal life or what? And you're living a perfectly healthy, fantastic life.
And I work full time, and I have 3 kids, and my daughter's I was concerned about her. She's made me a grandmother, so she's been able to have a healthy baby. He's 3 years old, and he's super healthy.
And how was her recovery post-transplant?
She had a little, some healing to do, but within 6 weeks she was back to normal, back to work, super healthy.
So not only that, like you said, you're back working full-time, you are also manager of the Canadian Transplant Games. They take place every 2 years, is that right?
Every 2 years.
Last 2 years ago was in Toronto?
Correct.
And this year you're hosting it here in Vancouver. Can you tell our viewers a little bit about what they can expect?
We are so excited to have it in Vancouver. Not only is it's going to be hosted out at UBC, which is an absolutely amazing venue because they've got everything out there. We're going to have the best facilities for tennis, best facilities for swimming, their track and field. They've got some great accommodations for all of our athletes. So it's going to be a great venue for our gala event at Chan's, opening ceremonies at Chan's Center.
Beautiful.
It's absolutely gorgeous. So we've got teams coming from across Canada. We've got a small group coming from Newfoundland. We've even got a couple of international athletes coming from Mexico and the United States. Yeah, we're really looking forward to hosting everybody. It's going to be a lot of fun.
So for all our viewers out there, especially in your lower mainland area, what can they expect? Can they come on out? Do they have to get tickets? What do they do? Where can they get more information?
They can come to the website at Canadian Transplant Association.com, or they can go to our Facebook at Canadian Transplant Association, and they can find out more information.
Someone like Brenda is such an inspiration. You're keeping so busy, working and managing the games and training to be a competitor. So good luck at the games. We will make sure that we catch up with you there.
Thank you.
See how you
We look forward to seeing everybody there. It's going to be a lot of fun.
Hi, I'm Kayla with Community Calendar. The Vancouver 2018 Canadian Transplant Games will take place July 2nd to 7th and will be held at UBC campus. All transplant recipients are welcome to register and compete in several different sporting events, including swimming, bowling, golf, cycling, and track and field. Competitors as young as the age of 4 years old up to the age of 70 plus are welcome. Living donors and donor family members are also welcome to compete, and there will be a special event competitions for them. While there are many exceptional transplant athletes who are at the top of the game, everybody is welcome to compete. No athletic ability is required, and often the loudest cheers are for those at the end. The games take place every 2 years, and they are the premier athletic event for transplant recipients. If you'd like to volunteer, or if you're interested to become a sponsor for the games, please find out more information on these opportunities at the website on your screen. Check it out. Are you living with polycystic kidney disease, and would you be interested in participating in upcoming PKD kidney patient journey events being held around the province? If so, please contact Heather at the Kidney Foundation for more information. The Kidney Foundation of Canada's 2018 Kidney Walk campaign is here. In communities all across Canada, kidney walks will be taking place to support people living with kidney disease and to promote awareness of the need for organ donation. Each year, kidney patients, transplant patients and their donors, family, friends, coworkers, and medical professionals all come together at their local walk to celebrate their journey, stories, and hopes. To register for the Kidney Walk in your community, it's as easy as 1, 2, 3. Number 1, sign up at www.kidneywalk.ca. Number 2, be a fundraiser. Number 3, form or join a team or register as an individual. And number 4, most importantly, have fun. Every kilometer counts in the fight against kidney disease. I'm Kayla for Community Calendar. Thanks for joining me. I'll see you next time on Plugged In.
Ariel in Nanaimo. My aunt has polycystic kidney disease and is waiting for a kidney transplant. Will they remove her kidneys that are full of cysts?
Ariel, so this is a question that most people that go into transplant ask. And the answer there is that this is very much an individualized decision. This is something that your aunt will talk about with her doctors and the surgeons doing the transplant surgery, and they'll talk about it based on the individual's characteristics. 10 or 15 years ago, I would have told you the answer was no, that we would have said to most people, unless something very bad happens, we're not going to remove one of the kidneys. And the reason for that is it's actually quite a big surgery. People are sometimes shocked to hear this, but taking out the old kidney is actually a bigger surgery than putting a transplant in. And a lot of it has to do with how big the kidneys are and some of the blood vessels that they're attached to and things like that. So before, we weren't routinely doing this at all because it was such a massive surgery. Now with modern surgical techniques, it's much more possible. They can actually remove a lot of these big polycystic kidneys with what we call minimally invasive surgery using small incisions. I tell people it's kind of like a magic trick that they can take a kidney this big out of an incision that big, but they are able to do it, and it's a much smaller surgery. That being said, it still kind of complicates a surgical procedure, so it's not offered to everybody. And even if it is offered, it's done sometimes in different ways. Sometimes it happens at the time of the transplant, whereas other times they'll have someone come back later on down the line and have the kidneys removed. So it's a very individual decision, but it is something that's possible and the surgeons will talk about.
Well, that's a very hopeful message for anyone out there that's got loved ones or has polycystic kidney disease themselves. I think that the hope is there.
Absolutely, and I tell people who have children with the disease that I think what I'm going to have to offer your children is much better even than what I have to offer you. This field is just going so fast these days that I think we really are going to have some great things and really change this disease as time goes on.
Well, that's a great way to wrap up today's session. Thanks so much. This is PKD with Dr. B, and we look forward to having you on our show again soon.
Great. Thanks, Deborah. Thanks, everyone, for your questions.
Okay.
That's why I drove and they rode their bikes.
Don't get nervous. I only have like 6 weeks left to work on this.
That's right, we will be ready, don't worry. We'll get you there.
Okay.
Oh, well done. High
Okay,
five. Good job.
Thank you.
All right, well done.
Like I got to the wall.
Try again. Yeah, of course, you got to throw it up with the ball. Yeah, up together with the toss.